Hi, everyone. I am Alex Vollmer, and I'm the Training and Content Operations Lead here at Cedar, and my pronouns are he, him, his. Happy Pride, y'all, and thank you so much for joining us today. As I just mentioned, June is Pride Month, and here at Cedar, we want to join the voices uplifting and celebrating the LGBTQIA plus community and their contributions to the world. Over the last several years, we have seen many wins for queer people in the United States and across the world. Yet, we've also seen renewed attempts at further disenfranchising some of the most vulnerable members of our community. There's still a lot of work to be done, and healthcare is just one of the many spaces where queer people seem to be fighting an uphill battle. So, what are we here to talk about today? It's really gets down to how do we transform healthcare so that we can all receive and provide care that we can be proud of? What will it take for everyone to be treated with dignity and respect and to feel supported and empowered throughout their healthcare journey? To get to it, please join me in welcoming our distinguished guests. Dr. Miriam Langer is a board-certified pediatrician specializing in adolescent medicine at the Children's Hospital of Philadelphia and an assistant professor of pediatrics at the University of Pennsylvania. Margaret Hughes is the Programs and Communications Coordinator for Glama, health professionals advancing LGBTQ equality. And Mason Dunn is the Deputy Director for the Division of Education and Training at the Fenway Institute. Thank you so much to each of you for taking the time to be with us today. I could not be more thrilled that you're all here. And I'm just so excited for today's discussion. Making sure that we will have time for questions from the audience at the end. Let's just go ahead and get started. So we'll start first for a question really for all of you. But let's start with some definitions. What do we mean when we talk about disparities in healthcare? And how do those disparities typically manifest during the LGBTQ plus healthcare journey? And then finally, how is resiliency so important and shown in all of these scenarios? So Dr. Langer, I'll take it to you first.
Thanks. That is a huge question.
No kidding.
I will try to start answering that. So when we talk about healthcare disparities, we talk about metrics in healthcare that are available to one population that are not available to another population. So when we are talking about some of the healthcare disparities faced by trans identifying people in the United States. So first we can start with insurance. So in a 2015 study, 15 trans identified people are more likely to be uninsured, 13% versus 10% of the general population. Trans people experience problems using their health insurance for the things that they need coverage for. So more than half of those a quarter of those surveyed reported that they had issues using their health insurance because of gender identity or gender expression, which I can get into. It has to do sometimes with like what gender marker is on your electronic medical record versus like what gender marker a service should be covered for. And then for gender specific services like hormones and transition surgeries, which some of these patients really need access to, many were denied, even those who had health insurance. And then what I think as a medical professional, really the statistics that get to me the most are that A third of patients reported having a negative experience, including educating their doctor about what they needed from their doctor. And I'm sure a lot of us have had some experience with that, but 33%, a third of patients, is a really high number. And then also, a lot of these patients feel that they are being refused care because of transition-related issues. So that's about 8%. So almost like 1 in 10 people are having problems really with healthcare professionals, which is a disparity that is not faced in other populations. And then these problems kind of culminate into people not seeking medical care, which then widens disparities in other areas. I'm going to stop there because those are pretty upsetting, and I'll let someone else take over.
I can jump in with kind of the point that I like to talk about a lot in these types of settings and opportunities is about the resiliency of the LGBTQI+ community. So often these conversations are, these overwhelmingly dark, depressing statements around, extremely high rates of depression, anxiety, suicide ideation, psychological distress, and it just feels, especially during Pride Month, so overwhelming. But the resiliency of LGBTQI+ communities, particularly LGBTQI+ youth, is something that I find utterly inspiring. And I love to think about how we can shift the narrative into this, strength-based approach to say these things are true, but there are community organizations, there are community-based opportunities to promote strength and wellness in our communities. There are opportunities to have dialogues about the adaptability of our communities. And that is something that I have seen over and over, the ability to adapt, the ability to come together, and to the ability to overcome in light of these disparities really points to the resiliency of our communities.
Yeah, thanks so much for that, Mason. And I also want to say, thank you, Miriam, for taking the duty that one of us had to do of listing the grim statistics. And I think that, one thing that can also get hidden in these conversations about disparities, in addition to the resilience that Mason is talking about, is just the cause of these disparities. Here's another grim statistic, the CDC data from 2019 shows that about 1 in 5 lesbian, gay, and bisexual adults are smoking, compared with 1 in 7 straight people. And then if we look at the data on trans people, which isn't even as good, we don't have as much data, but it shows that cigarette use is nearly 1/3 of transgender people are smoking in their lifetimes. And the thing is, LGBTQ+ people aren't just smoking more because we smoke more. LGBTQ communities have been targeted by tobacco companies and disproportionately live in poverty due to this nexus of homophobia and transphobia, and also racism, classism, etc. And that's associated with higher rates of smoking. So at Glama, we talk a lot about the social determinants of health, like lifelong stigma and harassment and discrimination, or just the fear of having to experience those things is this major cause of chronic stress and depression and anxiety and all these things that correlate also with physical health problems, and then get compounded by the lack of access to care that Miriam was talking about. So, disparities are at play in the healthcare journey long before a patient first experiences a health complaint, and long before they ever receive a diagnosis or access care. And actually, I'll take a little further. I want to give credit where credit is due and say a Glama member, a health professional, actually called me out a few years ago for describing LGBTQ+ populations as vulnerable. And of course, it's really common for us to say that, LGBTQ+ populations are vulnerable to these disparities. So I'm really just paraphrasing Harlan Pruden here. He's the author of the British Columbia Center for Disease Control COVID-19 Language Guide. And he asked me, who produces vulnerability? What is it that increases the likelihood of these disparities or these poor health outcomes? Is it individual people that happen to be queer and trans or people of color? Or is it systems of homophobia and transphobia and misogyny and white supremacy and settler colonialism that are actually creating these disparities? So for me, the bottom line, as people working in healthcare, is that we have to fight not just these disparities that we see reflected in the research and the really grim, upsetting statistics, be it cancer or substance use or HIV, but also that we have to be actively fighting these systems that are producing these disparities.
Yes, to everything everyone just said, and thank you so much to all of you for that. I think, unfortunately, we're going to spend a little bit more time in the grim because, we had this conversation last year and just got to keep having it until the people who need to listen. So let's talk, I guess, a little bit more broadly and unfortunately, a little bit more politically. Things are tough as a queer person in the United States right now, specifically as a trans person in the United States right now. And very specifically, trans youth continue to be targeted by various folks in the United States political world. So I'm interested in hearing from really anyone who wants to speak now, though I know Mason and Margaret will likely have quite a bit to say here. How do you think that current events right now exacerbate the issues of inequitable care that is experienced within the LGBTQ plus community?
I'll jump in and start because this is something both Margaret and I have worked on very personally and professionally, having been advocates and working on policy and healthcare policy and trans-specific policy is something that I've spent my career in as a lawyer, and being in the nexus of trans health advocacy and political advocacy has put me kind of in this unique situation of watching and learning and advocating as it relates to trans youth healthcare. Although it's not just trans youth, but I definitely want to highlight the fact that trans youth are experiencing extremely high rates of marginalization through political means, where states are outright attacking the ability for our trans and gender diverse kids to access healthcare, gender affirming healthcare. And that there's the climate of what that means for healthcare professionals. And Miriam, I'll let you take that a little bit since I'm sure you are experiencing it directly. But the conversations that I'm having with trans and gender diverse young people and their families and their caregivers and guardians right now are conversations of, do we move? Do we have the ability to move? Do we have the access to uproot our lives for the sake of health and wellness for young people? That kind of conversation is not something that should be had. And it's terrible and having a truly profound impact on the lives and well-being of young folks. On top of the healthcare ban bills, we're seeing these athletic ban bills. We're now seeing an attack on trans healthcare in Medicaid in Florida. So it is all feeding itself. And this narrative of going after trans young people and gender diverse young people is not new. And so even though the attacks and the ways that they are manifesting right now are relatively new, this has been a conversation that goes back decades about attacking particularly youth in LGBTQI plus communities. Advocates, we're well informed. We know how to fight these attacks. We know the talking points. We know how to sway folks in all different forums. But it doesn't mean that the headlines don't hurt. It doesn't mean that the 5 o'clock news talking about the trans debate doesn't hurt, because it does, and it's going to continue to have a negative impact on the health and well-being of our communities.
Thanks, Mason. I think, what I'd add to that is with these proposed bans, we've seen 15 states at the last count, and it keeps going up, proposing 25 pieces of legislation to restrict gender affirming healthcare. That doesn't even count the other types of bans that Mason was just talking about. When states introduce bills to limit gender affirming healthcare, even if they never pass, this has a chilling effect. So even if it's still legal in your state to provide hormone therapy, opponents of trans rights then feel emboldened to harass and target providers and then families. They're pulling from the anti-abortion playbook, right? And it creates a climate of fear for providers, which is something we're seeing as a healthcare professional association, but also, of course, for LGBTQ plus people seeking care. And as Mason points out, what that really means in this context is largely trans and gender nonconforming kids. But more broadly, one of the effects of these bills, these constant attacks, is a change in the window of what we think is possible for LGBTQ plus health politically and culturally. Like, these bills are redefining what we think of as being extreme. And that is their goal. Like, their goal isn't necessarily even to pass this legislation right now. It is to change what's on the table when we talk about trans rights and trans healthcare. So, you know, for those of us that care about LGBTQ plus health equity, we have to be really vigilant that when, you know, even as we're mounting an all angles defense of trans youth against this backlash, that we don't, you know, we can't lose sight of our big goals: gender affirming healthcare for everyone, trauma informed, racially equitable, culturally competent, affordable healthcare that's accessible no matter where you live or who you are, and dignity and respect for transgender people in every arena of life. And one of the big goals of these bills is to shift the window away from like that big goal of dignity and respect for transgender people in every arena of life, so that we are put on the defensive and saying, please, can you let our kids just like maybe socially transition and not get forcibly outed by their school teachers? And we have to keep saying, like, the goal is up here. We're saying dignity and respect for trans kids and trans people in every single arena of life.
And Dr. Langer, did you want to add your thoughts here?
I mean, I think the other problem is a problem of generally children in the United States of America are feeling unsafe right now, and they're feeling unsafe and they're feeling attacked in many ways. And kids pay more attention than we ever give them credit for. And attacking one group of kids in some ways attacks all groups of kids. And I think that the stress that our children are experiencing in the school setting, and then like with legislation being targeted against them or their friends, really, I don't want to take away the direct stress that places on youth of trans experience, but I also want to say that I think people don't recognize enough the stress that this puts on everyone. And it really is everyone's problem. This is not like the problem of a parent of a trans kid, or the problem of a teacher of a trans kid, or the problem of a trans kid. This is really everyone's problem. And this is the climate that we're allowing our children to grow up in, and my patients to grow up in, and like in whatever way you interact with children. And that needs to stop. Like, that cannot be this. We cannot attack children in any domain, in any dimension. We need to be supporting and raising them up, and not attacking them, because it really is affecting everyone, all children's mental health. If you look across the board, children's mental health is in crisis.
Well, thank you all so much for sharing. And, I think let's take a brief detour into something potentially a little lighter, which is to say, I think we've talked a lot about the disparities experienced by members of the LGBTQIA plus community in general. And we know that members of the LGBTQIA plus community who are also racial or ethnic minorities face even higher levels of those health disparities. And as I've mentioned, that is pretty grim, and it is a lot to think about. So in an effort to bring us a little bit more into the light, my question to all of you is, what kinds of positive shifts are you all seeing in any of these areas that give you at least some hope that we are, in fact, making progress?
I'm happy to start here. I think that even just like this field of LGBTQ medicine was not kind of considered its own domain, its own specialty, and it's a whole argument for another time if it should be its own domain and its own specialty. But the fact that attention is being paid to it as a specific group of people that have not, I wouldn't even say a unique set of needs, but in some ways a unique set of needs, but in some ways just need to go from the margins to the mainstream of healthcare. And every primary care provider should be able to provide these services. The way that we're talking about this in medical education, the way we're talking about this with the residents is changing. And what's the coolest part about it, I think, is that actually this is not now at this point, it has become a top-down approach. Like the deans and the people who are making the curricula are changing the curricula. But the way that changed was actually from the patients, from the trainees, from the medical students, from the college kids who were volunteering. Like this really came from the youth and from the community, and then has kind of trickled up, and now it's trickling back down in some really cool ways that I think is making the care become much more available, which is I think one of the biggest issues is barriers to care.
Sure, I can follow that because to me, one of the things that gives me and I think Glama as a whole the greatest hope that we're making progress actually is health professionals literally like doing what Miriam is doing right now and speaking out. So my story about this is kind of wonky. It's kind of in the weeds, and I promise it is really important too. So in December, the FDA changed its regulations for prescribing isotretinoin, which is a medication that treats severe acne. It's often given to transgender men and transmasculine non-binary people who are transitioning. It can also cause severe birth defects in pregnant people. And of course, pregnant people and transmasculine people can be overlapping categories. But until this December, this was the prescription guidelines were gendered. You had to choose male. Providers and patients had to choose male or female to just even use the prescription guidelines. And that created a significant access to care barrier for transgender people. And obviously posed really severe problems when we're talking about birth defects. So that changed in December. The FDA's regulations are now gender neutral. Patients and providers can just choose two categories: people who can get pregnant and people who cannot get pregnant. And that's great. But it didn't happen. It didn't happen in isolation. It happened because actually a Glama member, a dermatologist named Dr. Ken Katz, organized a bunch of healthcare professionals, Glama members, and our partners and colleagues, healthcare professionals who could speak with authority and expertise on these issues on behalf of their patients. And that is how we get those policy changes that make a huge difference on the ground for patients. So to me, a thing that gives me huge hope is when healthcare professionals who have whether it's administrators or physicians or nurses or EMTs, what have you, y'all have the trust and authority that people look to. And when healthcare professionals organize and speak out, testify in a Senate of a state that is considering a gender affirming care ban, right? Authorities listen to that, and seeing providers who know that to advocate for their patients means not just providing the best possible care, like in the clinic setting, but also, being on this panel and speaking with the FDA and testifying in the legislature. Like, that is how we make change and actually get wins, even in this moment of backlash. I should say one more thing too. Sorry, Mason.
No.
That is another big win. We expect any day now that proposed regulations that would reinstate non-discrimination provisions covering gender identity and sexual orientation explicitly on the federal level within, we're talking about Section 1557 of the Affordable Care Act. We expect those to come down any day now. So speaking of advocacy and what we can all do, we will need providers and administrators across the nation to express their support for those proposed regulations. We think that's going to be any moment now. So stay tuned at our website, glma.org, so that you can help be part of that change. Sorry, Mason, I would love to hear what you have to say about that too. Go ahead.
No, I'm all about getting those action items and those action asks, and is so important, and how we change the circumstance and really make sure that we see affirming change. I think for me, I've been doing trans advocacy and particularly healthcare advocacy and education for over 15 years now. And the ways that the conversations have changed in those 15 years is truly mind-blowing. I can, as a trans person accessing healthcare, 15 plus years ago, I would go into a doctor's office and talk about being trans, and I would literally have people either say, "We don't do that here," or "What does that mean?" And that "what does that mean" question has gone away in so many circumstances for me and many others. Not across the board, but we have seen a lot more awareness for trans and gender diverse folks in healthcare. And I think that's great. And there's still so much work to be done, especially to address that "we don't do that here" comment that we hear from providers on occasion. And probably more on that later. But so I think that gives me a lot of hope, is the awareness. I'll also say the leadership that we have seen and the awareness of individual rights, particularly for LGBTQIA+ youth, who are saying, "I have these rights and I will not accept, we don't do that here. I will not accept these disparate treatments. I will not accept that because I have rights." And that kind of advocacy, self-advocacy that we are seeing from LGBTQI+ folks, but particularly young folks, to me is astonishing and invigorating, and gives me so much hope, because there is awareness of our rights. There is awareness and ability to speak out when this kind of thing happens, to say, "I have rights and I will fight for them, and I will activate my communities, whatever communities those may be. I will activate them to fight with me." So the organizing as well as the advocacy is what gives me a lot of hope in our communities right now.
Amazing. Thank you all. So appreciate it. I think those glimpses of the arc of justice does indeed, or I'm misquoting terribly, so I'm just going to move on so I don't continue to do so. But Dr. Langer, this one's coming back to you specifically, and I think in your experience and expertise in providing care for LGBTQIA+ youth in your multidisciplinary clinic, can you talk us through your approach and the steps that you take to ensure that patients feel safe with you and can trust that you're in their corner as an advocate?
Absolutely. Well, all I can say is that I hope it works. I can tell you what I do. And I do feel like I have some pretty strong relationships with my patients, but it takes one thing to make someone feel safe, and it also takes one thing to make someone feel unsafe. And so we do toe that line every day. And I think kind of being aware that you're walking that delicate line is something that hopefully helps make myself and my colleagues stronger and more of advocates. But I can't guarantee this works for everyone, though we try. So one thing that I do think helps a lot is that we all in our clinic wear pronoun badges, and not only in our clinic, we almost the whole hospital has them. So we wear them when we provide specifically gender affirming services, but we also wear them when we provide every other service, whether it's to a patient of LGBTQ experience or to a patient not, or to one who we don't know is, right? Disclosure is not always the goal. We just want to make sure that we're providing opportunities and we're creating a safe space and a safe environment. So I think even just having the pronoun badge, we actually had, we've gotten some pretty positive feedback from patients across the board, like in the emergency room and like our primary care clinics, in our gender clinics also, just about how much they're like, oh, cool. Like, can we get pronoun badges when we walk into the hospital? And I'm like, well, that's a great initiative. We'll work on that. That sounds really fun. So I think that really just goes a long way, because it's a lot of it's about signaling, right? It's not about like a specific conversation. One of the things everyone gets annoyed about their healthcare providers for is like, we don't have enough time to have all those specific conversations. We really do try, but we don't always have time. So a lot of it's about signaling. So I think that's one way. We have tried really hard in our hospital to make sure that the pictures of patients on the wall are diverse in many ways, and that includes things that might signal like a less heteronormative lifestyle. So those are some things. I think other things are we really normalize a lot of conversations and a lot of questions. In addition to providing LGBTQ care, I also provide reproductive health across the board. And so we work really hard in all of our clinic areas to normalize those conversations. And again, I work in a teaching hospital, so we work really, really hard to make sure that not only are we normalizing them, but that the staff and the trainees are also normalizing these conversations. The whole idea is that everyone should feel comfortable in our environment. And then just in terms of, patient-specific interactions, I often have patients who ask me about the current events, especially like the day after like a new law is proposed. There's always like, and sometimes I'll try to acknowledge it before the family acknowledges it. Like, you walk into a room and it's clear that something's going on, and, just alluding to it, making it known that we're following along and we're following the news too. And we're living through it too. And we care, I think goes a long way. And then kind of on a clinic level, we also are able, when things happen in the news, we often send like letters to our families, just reminding them about the different ways in which the clinic is doing advocacy and the different reasons that we feel like our patients are safe and can continue to get the care that they need. But unfortunately, that's not possible in every state anymore. So I feel like I end every sentence in like a really grim way, but I do think things are and will get better. But those are some of the ways that we try to make patients feel more supported, and I think they really do respond very well to that. Sometimes that means like because of a pronoun badge, some patients have like their first disclosure to an adult, like in our clinic. Again, disclosure is not always the goal, so I hope that it also allows us to provide better care.
Yeah, thanks for sharing that. And thank you again for the amazing work that you and your colleagues do. I know that, if I was a kid if I had gone to the doctor and they were walking around wearing progress badges that had their pronouns, I would have been pretty darn excited to see that. So I think one more question directed to you, Dr. Langer, and that is, at this event last year, you spoke really poignantly about the external biases that are experienced by trans youth. And you explained that it's not being transgender that comes with these negative health outcomes, like the increased rates of depression and anxiety, but it's the external pressure and the non-affirmation that trans youth are experiencing. So I guess I wanted to check in and see what, your take is these days on the toll that is being taken on the mental health of trans youth, and just expand on that notion of seeing kids as kids, accepting them for who they are, and then talk a little bit about like what you see as the positive benefits of gender affirming care for trans youth.
Totally. So I actually think Margaret spoke to it earlier when they were talking about how I believe we're talking about what makes a population vulnerable, and is it like that they are a vulnerable population, or have a lot of external factors created a pretty negative situation? And the data really supports that. There was a study done that showed that youth who were affirmed by some adult in their life, in some situation in their life. So that could be like from their home, like in their family. It could be a teacher. It could be in a religious setting. It could be like a grandparent. If they were affirmed in some area of their life, their levels of depression became kind of equal. The rates of depression became equal to that of their cisgender peers. Rates of anxiety were like not really clinically significantly higher. And we also know that rates of suicide really decline. So all these things suggest that this is not some like internal genetic problem in this population, but that really it's based on a lot of external factors. And I think that gives all of us an amazing opportunity to really get involved and to really change the experience, right? Because if it's not that there are so many health problems that are not like community-based. Well, there's a lot of problems that are, but there's so many health problems that are not about like the attitude of the community necessarily at large. And I think this shows that really like being supportive and affirming someone's identity can make a huge impact in their life and in the way that they feel safe, and the ways that they feel safe impact their stress levels, and their stress levels impact their cardiac health and impact their desire to smoke, and impact some of these other impact cancer rates, right? And I think some of these other statistics that we were talking about are all impacted by how safe people can feel in their communities. And we all have the opportunity, just in the way that we conduct ourselves in our day-to-day life. It can be a pretty small, it doesn't take a lot. It's seeing a person as a person. It's seeing a human as a human. It's seeing kids as kids. That's what it takes to make a person feel comfortable in this world. And that's something like, it's kind of an easy ask if you think about it.
Thanks for that. It reminded me of one of your co-panelists last year, Andrew Miller. He talked about seeing kids as being experts in who they are. And I think like that still sticks with me in terms of, yeah, kids are kids, but like the project of one's life is figuring out all of this. So who are we to say that a kid's making a mistake at some point, Then, Mason, this next question is for you. And I'm interested in hearing at the Fenway Institute, which initiatives are you most focused on these days in terms of the LGBTQIA plus health education work that you're doing? And in which areas are you seeing the greatest urgency and need for outreach?
Yeah, I would say globally, really thinking about ensuring equitable and accessible care is about making it accessible in your own community. We shouldn't have to go to quote unquote specialists for primary care. Any primary care physician should be able to work with LGBTQIA plus folks. And yet, unfortunately, we're seeing this need for folks feeling like I have to go to Boston, I have to go to New York for this, quote unquote specialty care, when as a trans person, me experiencing terrible allergies like I am today is not a trans-specific need, but I still need my provider to know about my pronouns and my common use name versus a legal name and gender markers. Like my doctor needs to know about that, but I shouldn't have to travel to Boston to get that care. And so one of the things we're providing right now, we have running right now is a trans echo. So it's a year-long echo learning collaborative or learning module for rural healthcare. And that's one of the things that I'm really invested in and deeply passionate about is LGBTQIA+ healthcare in rural communities. And I specifically think about an instance when I was doing trans advocacy in New Hampshire. And I was north of the Notch, so it's pretty rural up in northern New Hampshire. And I was talking to folks about accessing trans affirming care, and I said, "Do you have health care? Is it accessible?" And somebody said, "Oh yeah, we have wonderful, trans affirming health care locally." And I said, "Wonderful. Who are you going to?" And they said, "Oh, we go down to Boston to Fenway Health." And I looked at them and I said, "That is a 4-hour drive one way to access primary care health care. That's not accessible." And so that really continues to motivate me to think about ensuring folks can get care where they are, where we are, whether that be in Boston or north of the Notch in rural New Hampshire. And so that's one of the endeavors that I'm really taking on personally and feel very strongly about. Beyond that, it is about just the specific care that might be unique to LGBTQIA+ folks, whether it be intersex care needs, and ensuring that folks are informed about that. Really making sure that we're addressing the intersections of our communities. We recently put out a publication about affirming healthcare for Native American and Indigenous communities and Two-Spirit communities. So really thinking about intersections. And there are, we've put together lots of publications and lots of webinars and seminars on this work. But at the end of the day, it's about ensuring that information gets to healthcare providers from in every walk of life, in every jurisdiction, every zip code. My goal is to get every zip code in the U.S. Accessing our materials or learning more about LGBTQI+ affirming care. And that's the goal. That's the work.
And what incredible work it is. Thank you so much for sharing. All right, Margaret, putting you in the hot seat now. So what or can you tell us a little bit about some of the current initiatives at Glama and what you're hoping specifically to achieve? And I know that there's a pretty big health conference coming up this fall, if you wanted a chance to plug that.
Definitely. Thanks, Alex. Yes, happy Pride. We have our 40th annual conference on LGBTQ health coming up in San Francisco, where we were founded in 1981 at like the height of the early AIDS epidemic. So we're kind of returning to our roots and super excited about it as a continuing education opportunity for healthcare professionals of all disciplines and professions to come and hear like the latest research and also just best practices around caring for LGBTQ patients and clients. We're expecting over 500 social workers and physicians and behavioral health professionals, nurses, nurse practitioners, trainees and students to show up. So it's a really great opportunity, and we are like in the full swing of that right now. But actually also going back to, what Miriam was talking about a couple of questions ago, we're in the fight against some of these anti-trans, not bills, but laws that have been passed, where Glama has joined with other leading healthcare professional associations to submit friend of the court briefs in some of these cases where these laws are being challenged. So as folks might know, Alabama was the first state in the country to pass a ban on gender affirming care for trans youth, which makes it a felony for providers to actually offer this kind of care. And Glama joined with over 20 leading health professional associations to submit a friend of the court brief in support of a request for a temporary restraining order, which actually we did get, although, things are kind of ongoing. And the power of that, we also have Health Professional Association briefs in Texas and Idaho, cases challenging these gender affirming care bans, but also sports bans, which we know have this, as everyone's already talked about, like have this reverberating effect on mental and physical health for trans youth. And so we've been using these briefs to make the case from a healthcare professional association perspective that gender affirming care is life-saving and it is medically necessary. So kind of being the voice that's saying, actually, the consensus of leading healthcare professional associations is that these bans that are often done in the name of healthcare providers and of science are not scientific. They are not backed by the majority of healthcare providers. They are not backed by the leading trusted healthcare professional association voices. And to, again, we're talking about sort of leveraging the expertise and trusted nature of healthcare professionals of all stripes, that judges actually listen to that sometimes, which is cool. To hear healthcare professionals saying, actually, you can't do this in our names. You can't say, oh, this is, healthcare providers shouldn't have to provide this type of care. Here's a bunch of healthcare providers saying this is actually the best practice. This is what we consider to be our duty, etc. The other thing that's in the works right now that I'm personally really excited about, and to kind of get to sneak preview with all of you here, is that more than 15 years ago, Glama created the first national directory of LGBTQ plus affirming healthcare providers. And we encourage all clinicians and healthcare providers who support LGBTQ plus communities to join that network. And this Pride Month, right at the end, we are launching a new and improved and much more beautiful and updated edition of the LGBTQ plus healthcare directory in coordination with our partners at the Tegan and Sarah Foundation. So it is very shortly going to be open for clinicians to join at the end of Pride Month. And then soon LGBTQ plus healthcare seekers are also going to be able to access our relaunched provider directory so that everyone in our communities can find the care they need no matter where they live. Kind of this idea that Mason was talking about. This is just one tool that that we offer for people to be able to find someone they need, maybe closer to where they actually live. And in the meantime, our existing directory continues to connect LGBTQ plus individuals with affirming providers. But stay tuned. By the end of Pride Month, I think we're going to have a really exciting directory available that can be a really good thing for providers who want to be more visible. As I know I'm affirming, but do patients know that they can come find me and trust me, as well as for patients themselves.
Oh, incredible. You all do such inspiring work, and I'm just continue to be thrilled to be in discussion with you. So I think we've talked about this a little bit so far today, but I am interested in hearing from you, Dr. Langer, and then also from you, Margaret, about the increase in prioritizing cultural competency training across the board when it comes to folks who work in the healthcare industry. What are the trends that you all are noticing here? Are healthcare organizations, do they tend to talk more openly about it, specifically in relation to providing healthcare to LGBTQIA plus identifying people? Yeah, just what are your thoughts? What trends are you noticing? And I guess we'll start with Dr. Langer.
I think it's become much more common that people are noticing that they are lacking in this area. So the number of requests that we're getting, it used to be when I was a trainee, I had to go out and find someone to train me in this. And then I brought it back to my residency program, and we hadn't had any discussions about LGBTQ health to that point. And now here, we have division chiefs coming to us and being like, it is clear that our division is very behind in this, and we had our first trans patient, or, which is kind of hard to believe, but anyway, or we just, someone has woken up and been like, our division needs training in this and we are lacking it, and we are lacking in this area and we want the help. So instead of it being like us being like, hey guys, this is an important issue, can you please pay attention? It's a lot more people being like, this is an issue, can you help us? Which I think is really, we have a captive audience in this moment. And I think figuring out ways to take advantage of that captive audience and to reach more people is kind of the calling at this time.
Yeah, that parallels so closely what we're experiencing at Glama as well. Like I said, our annual conference has been going on for 40 years now. And at our last in-person conference, we had a record number of attendees. And I think that we've sort of seen this upward trend. I just think that speaks to the increased sense of urgency and that sense of that gap that Miriam is talking about, that people are increasingly recognizing the need for this training and continuing education. I would also say, we need every discipline to include LGBTQ plus health curricula in the schools and programs that educate providers, like medical and nursing students, absolutely, yes, but also physical therapists, dentists, social workers, PAs, EMTs, you name it. We're increasingly seeing a move actually to train front desk staff and security staff on LGBTQ plus competence too. We had a really great presentation on that at our last conference. And these are all touch points in a queer or trans person's healthcare journey. And it's like, I don't want to say it doesn't matter, but like, it doesn't matter how great my primary care provider is if I don't ever make it into her office because the front desk staff misgendered the patient, right? And then I think there's also an increased recognition that we're seeing that, cultural competency for LGBTQ plus people needs to include training, not just around sexual orientation and gender identity, but also around race and ethnicity and language and immigration status and religion and socioeconomic status and all of these things that kind of by that same token, like, it doesn't matter how trans affirming a provider is if they're, going to not be able to speak your language, literally or figuratively. And so I think we're seeing an increased focus on that in just like the type of presentations we're seeing at our conference, for example.
I just want to quickly mention the point around frontline staff is so important. And that's actually, we built into our rural Transeco a whole track that's specifically for frontline staff. There's no clinicians, it is frontline administrative staff to have the same access to the training and around language, terms, definitions, care. We have folks who are in IT, and the importance of IT in LGBTQI plus inclusive care in your healthcare center is unbelievable, because if we're talking about electronic health records, making sure that those are affirming and have space for identity and conversation, all of that is just, it needs to happen. So when you are thinking about LGBTQI plus inclusive training, you can't only focus on clinicians or, while clinicians super important, nursing staff very important, don't leave out the administrative staff, the frontline staff, the IT staff, who also have touch points with these communities.
Yeah, that's amazing. I think what we're getting at is it takes a village, and the whole village needs to be affirming. So moving on to the next question. I'm interested in what y'all's thoughts are, and this is kind of getting at the, like, being the IT person in the room. How do you all see, or like, what potential do you all see for technology to help move the needle here?
I'll jump in and just say telehealth. Telehealth is such a huge area that can open up access to care for folks. Not just thinking about, I'm going to be able to access a care provider in a different location, but also thinking about folks who have different accessibility needs, whether it be not having access to reliable transportation to get to a healthcare office, folks with disabilities who might be able to access care more reliably and more safely from their home. That kind of technology and the ability and affirmation in telehealth is huge, and it's shifting the way that LGBTQI plus folks and many intersecting communities can now have access to care. There's a lot of other things I could say, but I just wanted to put my plug in for the importance of telehealth and how important it is to continue to allow and make it a safe and accessible form of healthcare.
You go first.
I just wanted to piggyback off that and say one other thing that I think makes telehealth so incredible is that, as we talked about, doctors' offices are not traditionally safe spaces for LGBTQ plus communities. And so one of the benefits of being able to do telehealth is that the patient can choose their environment, which as a provider, it's really helpful if my patient is comfortable for me to for us to really get what each of us need out of the visit. And I think for the patient to get the most out of the visit, they need to be comfortable speaking up. I wish I was a mind reader, but I am not. And so I think that is a really big piece of telehealth that I think it's a patient-centered piece of telehealth that is sometimes overlooked in these conversations. So I just wanted to bring that in also. And then the other thing is I think that the EMR, as Mason was saying, is still a place of exclusion oftentimes. And so there's a lot of room to improve the EMR, and large EMR systems often say that it's really impossible to make any changes, which if you know anything about tech should be able to be innovated very quickly. And so that does not make any sense. And so there's a lot of room to improve patient experience and accessibility through that. And then there was one other thing I wanted to say about tech. I'll hand it over to Margaret and I will maybe take it back after.
Yeah, I'm glad you brought up EMRs, but also other forms of technology that patients or clients encounter. Those, they kind of have a chance to send signals to patients before they ever walk through the door, and either leave a good or bad taste in your mouth afterwards. And these tools can be used for like collecting sexual orientation and gender identity data confidentially, using, all of the things that we talk about can be integrated into these type of tools. So recording patients' pronouns to decrease misgendering, having the right terms on the form, but also making the technology available in multiple languages so that LGBTQ plus people who have a primary language other than English have equal access. I want to shout out our partners at the National Queer and Trans Therapists of Color Network have a great provider directory that is available equally in Spanish and English. And I think that's kind of an exciting direction. But really, there's so much potential for these tools to help address these disparities, but they have to be backed up by comprehensive training. It doesn't matter how good your form is if you don't, know how to use it, right? And I think, to me, it's why it's exciting, like that a company like Cedar is doing this, to have both of those pieces kind of work in sync, the training and the actual really good technological tool.
I remembered. I would just like to add that I think there's also a really big opportunity for data collection with electronic medical records, which of course has to be used for good. And of course, there's like all sorts of ways that we need to protect that as well. But we do have a lot of patient privacy laws already in place. And I think that knowledge is power, and we need to be using the EMR much more than we do in order to understand gaps and strengths both, and use them to move the needle forward.
Awesome. Well, thank you all. I'm feeling very inspired. by your feedback for the tech folks in the room in general. So for the people who are joining us, we are technically speaking at time, but I didn't want to leave this particular panel without posing one final question to the panelists. And that is, I'm wondering if any of you would be willing to share with us care you can be proud of moment. So this is an anecdote of a recent encounter or maybe a project in the works. I know we talked a little bit about some of these like progress indicating factors, but if you've got an anecdote of a recent encounter or a project that you're in the works that you believe will uplift or transform this experience for queer folks, would love to hear about it and end on that bright and hopeful note. Mason, take it away.
It was the head, because I was thinking, and you know, there's so many things that I, just this conversation gives me so much hope, and you know, I was just reflecting on how important these types of conversations are, bringing together different perspectives, different voices in LGBTQI plus healthcare is just like magic in the making to me. You know, some of the things in the works for me and working with Fenway. We're hosting our annual Trans Healthcare, Advancing Excellence in Transgender Healthcare Conference, which happens every fall. You can find more information about that on our website. The vast majority of our speakers for that conference are trans or gender diverse themselves, and I think that that is the other piece that I love to lift up is when LGBTQI plus folks, but particularly trans and gender diverse folks, and really trans and gender diverse folks with intersecting identities around race and immigration status and disability and so many other things, when those voices are lifted up for the expertise and the lived experience and lived expertise that they bring beyond their education and everything else, trans folks and gender diverse folks speaking on their rights and their health is, to me, some of the most empowering moments in my work. And so lift up that conference as well as just the continued work of the National LGBTQI plus Health Education Center, where the majority of us working here are also trans or gender diverse. And I think that speaks to kind of the investment that we make in our communities and lifting up our own voices and empowering our communities.
Margaret, I'll take it to you now.
Sure thing. I don't know if I can even follow. I love what Mason just said, and something that I didn't get to say earlier when we were talking about like what can what can healthcare settings do to be more welcoming and affirming, that I also get to see happening every day through my work is hiring LGBTQ plus providers, right? Like just what Mason was talking about, like, and you don't have to be LGBTQ plus to be an excellent and affirming provider, but I see, this feels really small, but like I see more and more requests just coming into our inbox every day saying, we are hiring insert healthcare profession, and we want you to share this with your members because we really want to have LGBTQ plus people in these roles. And I think that's so important. And it's like, it's really exciting to me when, you know, we were talking about this earlier, like I can't imagine, I've still never seen a healthcare professional in my personal life with the type of badge that Dr. Langer is wearing every day. And knowing that more and more healthcare settings are looking to bring LGBTQ plus people into this work, that makes me really really inspired and really hopeful.
I just feel really lucky. I totally agree with some of the things that were said earlier about how this shouldn't be like kind of its own siphon field, and it should really be integrated into every area of healthcare. I also feel really lucky to be part of a group that is devoted to this work and committed to this work. We do school trainings on how to make schools more inclusive for our patients, because when schools aren't inclusive, it can lead to other healthcare issues. So we definitely see that as part of our realm. And safety in school is, of course, paramount to our patient success. So we do school trainings. We have been involved, I don't know if you all are following the Pennsylvania school board issues, but we've been involved in some of the school board conversations and making sure school boards trying to make sure school boards continue to stay open to our patients. We are involved in advocacy in many, many forms. We do a lot of trainings for healthcare workers, but also for other professionals kind of around this area. And so I just feel like so lucky to be part of a group like that. And I feel even more inspired by the fact that more and more we are not unique, which is awesome. I do not want us to be unique. There should be like multiples of these groups, and they're popping up more and more every day. And so that is really inspiring and encouraging to me.
Amazing. Well, thank you all so much. Getting to have these kinds of conversations with the folks who really are on the front lines of these issues is truly the highlight of my professional life. So thank you all so much for sharing your time with us. And thank you to the attendees for making the time to attend. And yeah, happy Pride. I hope the weather's nice wherever you are and that you can go enjoy a little glimpse of what is hopefully a comfortable summer. So thanks everyone, and hope you have a good one.
Thank you, and happy Pride.
Thank you so much. Happy Pride.
Thank you for having us. Happy Pride.